Hello, everyone. Welcome along to the session as well. My name is Maria Lohan. I'm a professor of social science and health at Queen's University Belfast, and I specialise in developing and evaluating interventions engaging men and boys in sexual and reproductive health and in systematic reviews. And I've been working with the team here on evaluating the evidence. So thank you for the opportunity to speak with you. My son is laughing in the background. It's very, it's a strong endorsement.
And Shari?
Hi, good morning. Well, afternoon and evening as well to the rest of you. I'm Shari Dworkin. I'm Dean and Professor of the School of Nursing and Health Studies at the University of Washington, Bothell. And my expertise is in gender transformative interventions with men to improve sexual and reproductive health outcomes in sub-Saharan Africa.
Great. Before we start, I just wanted to maybe lead us or walk us through the objective session and the context in which we are, in which we frame today's session. The objectives for this session, the first is really to share the evidence on the extent to which interventions working with men and boys in the context of sexual reproduction are addressing gender transformative approaches. And the second is really drawing on this evidence as well as a lot of the practical experience and expertise that implementing partners have contributed to reflect on what is the research agenda for making the work with men be more explicit in addressing power relations and harmful masculinities. And the context in which we've framed today's conversation is really that, in the last 2 decades or 25 years now, there has been a lot of movement and a lot of progress made in advocacy, in program development, in evaluation of interventions. And we do recognize, I think there is a general consensus that we have to engage men and boys and address masculinities when we are talking about programming for gender equality. However, we need to critically look at the body of evidence and see to what extent in practice and in policy and on the ground has this actually been translated in gender transformative ways. This is critical because as we look forward to what we want to do with respect to gender equality programming and gender transformative programming in this space, we need to draw on lessons learned in the last 25 years, identify where progress has been made, identify what the challenges have been, and really take the work forward in ways that, at minimum, as we say, do no harm, but ideally really strive and continue to strive to promote gender equality. So in a way, we are at a critical point, Beijing plus 25. We are in the 26th year of the ICPD agenda. SDGs, we have 10 more years to go. And so this is a particularly critical moment to stock take, so to speak, as to how we're doing on working with men and boys. The format of this session, we will have one PowerPoint presentation involving the presentation of the evidence. But after that, it's going to be a dialogue, a conversation, reflections by the panelists. And then we will open it up for comments and reflections and Q&A from all of you. And also we will have a little bit of audience participant engagement through Slido and a few opinion poll methods. So I'm going to, with that, hand over to Maria Lohan to take us through the global evidence on what we've learned on what works with men and boys in this space, in the SRHR space. Maria, over to you.
Avni, thank you very much. I'll just share my screen. Okay, so thank you very much for the opportunity to speak to this topic, engaging men and boys to improve SRHR, sexual and reproductive health and rights for all, the state of the global evidence. And I'm presenting today on behalf of the review teams who I'll introduce shortly. So Avni asked me to address these 2 questions. What is the state of the global evidence on interventions that engage with men and boys to improve sexual health and SRHR? And what is the global evidence specifically on gender transformative interventions with men and boys in the context of sexual and reproductive health and rights, particularly describing the characteristics of gender transformative interventions. To address these questions, I'm going to call on two pieces of research that we have been recently doing. So to address the first question in terms of the global evidence on interventions, I'll draw attention to two evidence and gap maps, which we've published to the WHO SRHR website, and a systematic review of reviews, which is published in BMJ Global Health, and that is the link to that article. And I hope also I've just put it in the chat box. To address the second question, we went to a deeper dive of the actual intervention studies to look at the gender transformative intervention studies to describe the characteristics. And the systematic review of these studies is also published in BMJ Global Health, and there is also the link. So to preface this conversation as well, we've used the WHO definition of what is gender transformative interventions. And so in brief, just to say, these are interventions which address the causes of gender-based health inequities by including ways to transform harmful gender norms, roles, and relations. And the objective of such programs is often to promote gender equality and progressive changes in power relations between women and men. So we completed 2 reviews, and just to acknowledge the large team members that were involved here, it was a consortium between Queen's University Belfast and the World Health Organization, including our Campbell partners. And again, for the second review. So to address the first question, what is the state of global evidence on interventions that work with men and boys to improve sexual reproductive health and rights for all? The methodology of the evidence and gap map and systematic reviews, in brief, was as follows. We conducted a database search of several electronic databases with no language restriction between the dates of January 1st, 2007 and July 31st, 2018, and pre-published this search in our protocol with the Campbell collaboration. The inclusion criteria for reviews to be included in this review of reviews were that it must address any of the 7 WHO SRHR outcomes, and we double-blind read 662 systematic reviews to identify reviews that included studies which engaged men and boys in sexual and reproductive health and rights, and were also systematic reviews that included evaluations of these interventions based on experimental designs, either randomized controlled trials or quasi-experimental design, meaning pre- and post-design studies with control groups. So we were looking for evaluations of interventions. The included reviews in the end systematic review and evidence and gap map amounted to 462 reviews of studies engaging men and boys in sexual and reproductive health, and 39 studies which specifically included studies which were gender transformative in nature. So this is the resulting evidence and gap map from this exercise. And I'll just walk you through this briefly. I know it's quite small on the screen. So along the top are the WHO SRHR outcomes. So here we have desired family size, health of pregnant women, infants and girls, preventing unsafe abortion, promoting sexual health and well-being, sexual and reproductive health and disease in disease outbreaks, healthy adolescence, and preventing violence against women and girls. And the blue bubble represents all of the systematic reviews engaging men and boys under these topics. And the red bubble represents those reviews which have included studies which are gender transformative in nature. And so what you can conclude from this map is that, first of all, the greatest deal of evidence lies under promoting sexual health and well-being. Next is desired family size. And next comes healthy adolescence. However, these are the areas for which there is actually the greatest imbalance also between studies on engaging men and boys per se and studies which are engaging men and boys through a gender transformative approach. The domain for which there is the most studies on working through a gender transformative approach, again, evaluation studies of interventions, is in preventing violence against women and girls. So here the ratio is approximately 1:1 in this, whereas over here it's approximately 16:1. Now, one of the advantages of these maps also is that hopefully if I click on this, you'll see that it's an interactive map. And I want to shout out to my colleague, Martin, for his assistance in this regard. So for helping me with the technology here. But here, if I click into this, you will see the list of reviews pertaining to this outcome domain. And we wanted to basically put this research at other researchers' fingertips, if you like. And here you will see it's coded in terms of reviews that contain gender transformative interventions and those that don't. And the abstracts for those are available there. So now I'm just going to go back into my presentation. And okay, and hopefully it will come down onto the next map. So here is a second map with the same evidence presented, but here we present the evidence in terms of its geo-economic distribution. So along the top here, we have the gender transformative interventions. And here, the green, I'll begin with red. Red represents studies in low-income countries. Green represents studies in middle-income countries, and blue represents studies in high-income countries, and the orange is for where this was not decipherable. So we went back into the reviews, pulled out the interventions, looked at the place of study for each intervention study. And this is how we constructed this map. And again, it's interactive, so you can follow the reviews that are categorized under this. But what we can conclude from this map, actually, is that cumulatively across the research, there is roughly an even spread in research on engaging men and boys in across low middle income countries. It's roughly evenly spread across those. And in relation to gender transformative interventions, the same is true. But I'll show you this a little more clearly in my next map. So here is a map solely of the gender transformative intervention evaluation studies. And over here, you can see, it may be covered by the pictures of people here, but you'll see that low and middle income countries and middle income countries combined give 34 studies. And in high income countries, we have 32 studies. And the trend over time was to a greater amount of studies in low income countries. But you can see that the concentration in high income countries is in the US. Just to present another map very briefly, again, this is the gender transformative interventions only. You can see clearly where the gaps are in the research. So you can see again the predominance of research under preventing violence against women and girls, which is the final 7 category over here. Whereas actually when we did a deeper dive into the studies on the gender transformative studies, we concluded that there were no studies on preventing unsafe abortion, engaging men in a gender transformative approach evaluated on preventing unsafe abortion. And similarly, no experimental design studies on gender transformative approaches with men and boys in the context of SRHR outbreak, number 5 there. So let's take some overall conclusions from this piece of work to answer what is the overall state of the global evidence. And the first conclusion really is that only 8% of the total systematic review evidence of experimental design evaluation of interventions engaging men and boys across all of the WHO SRHR outcomes uses a gender transformative approach. Most of the gender transformative program evaluation lies under one single domain, that of preventing violence against women and girls. The key gaps where there is no research using these criteria is in preventing unsafe abortion and SRHR in disease outbreaks. And so gender transformative program evaluation is almost equally likely to occur in lower and middle income countries combined as in high income countries, with a growing trend towards low and middle income countries. Now to move to the second question, what is the global evidence on gender transformative interventions with men and boys in the context of SRHR, and specifically looking at describing the characteristics of, or the content of these programs of gender transformative interventions? The methodology for this systematic review of the intervention evaluation studies briefly was as follows. So we went back into the systematic review of reviews. We pulled out the individual records of the intervention studies, which amounted to 509 records. Following screening for duplicates, we came down to 175 records. We double-blind read these 175 records and ultimately excluded further studies based on not explicitly being having gender transformative content with men and boys. So for example, perhaps that content was only targeted towards women. Perhaps they included men in the study, but didn't actually deliver the intervention to men. So on a deeper dive of those studies, we excluded further studies and arrived at a figure of 68 studies to be included in this systematic review of reviews. So just a word now on how we then analyzed these studies. So first of all, we conducted a risk of bias assessment on the intervention studies to look for methodological quality of the intervention evaluations. Then we analyzed the studies in terms of truncated, tidier lists. And tidier guidelines are basically standardized guidelines of how you just deliver interventions. So it looked at things like who was it delivered to, who was it delivered by, who was it to, for how long, etc. What was the underpinning theories? Then we also looked at it in terms of gender transformative characteristics. Now, bearing in mind all of the studies that are included here have already fit the WHO criteria for gender transformative interventions. But here we wanted to look at the extent to which these gender transformative interventions intervened at individual and group level in terms of transforming gender inequalities, or also targeted wider societal mechanisms or wider community mechanisms. The fourth way in which we analysed the data was trying to get to the heart of, well, what are the content? What do people do to make these interventions gender transformative? And for this, we described all of the interventions against the COM-B model of gender behaviour components, because it gives a very extensive list of how you would develop interventions or what mechanisms you would use. And I'll show you this in a moment. And finally, we analysed, we looked for interventions that were analysed more than once in two different contexts using experimental design to give us a kind of a set of more robustly evaluated interventions over different contexts. And we came up with a subset of about 8 interventions in that regard. So there are several key findings detailed in the paper, but for the sake of brevity, can I just pull out 2 for you here today? The first one is that the most common types of male engagement gender transformative programming, in terms of evaluated programs using these designs, are community mobilization and education programs. There were 17, and I can't see the percentage, but it was approximately 20%. School or after-school education programs, there was 15 of these, and court-mandated programs, 12 of those. Percentages, from my view, are behind your pictures there, but those are the 3 dominant types. And below that are other types of programs. Key finding 2 is to address this question of what works. What were the promising programming mechanisms in gender transformative SRHR programming with men and boys that were demonstrating efficacy? And for this, we concluded that one of the first key components that was common across these programs that were demonstrating efficacy was that they were multi-component programs, and they were designed to enhance in the COM-B model, and I'll show you this, across capability, i.e. people's ability to transform unequal gender relations, motivation to transform gender unequal relations, and the opportunity to do so. So within these interventions, there was multi-component activities covering education, persuasion, modeling, and enablement. So if I show you this using the COM-B model, for example, okay, these are the types of intervention mechanisms that they categorize that can be found in intervention. So here we had education and persuasion widely used, modeling and enablement, and that covers the capability, opportunity, and motivation ideas. The second was programs that use multi-level programming that reaches beyond the target groups or individuals involved and try to reach out to wider community or societal mechanisms to adopt egalitarian gender norms and practices. Also were those that showed efficacy. And we found, however, that this is currently a very underused strategy in gender transformative programming with men and boys. So most of us actually, in doing our interventions with men and boys, are targeting the groups and individuals we work with, whereas it's actually harder to pull out to wider societal mechanisms. And again, I'll show you this using the COM-B model. So in the COM-B model, for example, the wider outline is wider societal mechanisms that could potentially be used in interventions, such as guidelines, fiscal mechanisms, regulation, service provision, legislation, communication, marketing, and environmental social planning. In our 68 studies, those studies that reached out beyond this inner circle of working with groups and individuals primarily used the mechanism of community marketing, so wider social media campaigns, for example, or wider mass media campaigns to address wider social norms. So the main mechanism used, as I'm saying to you, is this community marketing approach, which is out here in the wider bubble. Thirdly, working with both women and men, either in mixed sex groups or single sex groups, tended to be more successful. And delivery of activities by trained facilitators, either peers or professionals, and for a sufficient duration of time, ideally longer than 3 months. And very few of the interventions in our studies were interventions of longer duration than 3 months. Okay, so some key conclusions in relation to this question about gender transformative programming and the first question. What did we learn overall? I think overall, what we learned from these 2 reviews is that program evaluation using experimental design of gender transformative male SRHR programming is in its infancy, approximately 8% of the total review evidence. We found out where in the world this evidence is currently available and in relation to what outcomes and where the key gaps were. We examined what works to effectively engage men in programming, which I just described, and also to show you what has been relatively untried in these programs so far. We concluded that the quality of research overall needs to be improved through greater cooperation between researchers and programs if we're going to push up this research. And finally, in our wider discussions also, we acknowledge that the global qualitative research in this regard has been uncharted. And global qualitative evaluation research has been uncharted. And this also may be most useful in terms of the underexplored areas where we found no experimental design research in relation to preventing unsafe abortion and in relation to SRHR and disease outbreaks. And B, in terms of charting interventions, charting in greater details intervention content and the acceptability of those interventions. So that's where I'd like to conclude, and just to acknowledge the funding that we received to conduct these reviews. Thank you very much.
Thank you very much, Maria. Before we go to the other panelists, this is a pretty big exhaustive work, and I just wanted to maybe take a pause here and ask the participants if you have specific questions for Maria about the evidence that she's presented. If you post it in the chat box, I will read these out for her. We can take about 5 or 10 minutes to ask questions to Maria. Maria, there's a request to paste to share the links of the 2 papers again in the chat box for some of the participants who joined later.
I'll do that, certainly.
Yeah. And then there's a question about whether they can get access to the PowerPoint.
Yes, I'm very happy to make this available, and perhaps Magale can answer how we might technically do that.
Okay, so those are the 2 sort of more practical questions.
Yeah.
Any other questions about the evidence that Maria has shared? Okay, so there is a question. Hold on, I'm just maximizing my window for this. So there's a question from Leila from UNFPA. What were the other SRHR areas where gender transformative work with men that was studied? That's one. So one is a question about other SRHR areas. Secondly, there's a question from Tim which says, did you find anything about conceptual approaches? For example, did studies look at hegemonic masculinities, and how did they concept gender in their approach? So that's the second question. And third question for you, Maria, and I'm reading it because it's a long question. It says, I notice that this research has noted that what seems to work effectively with men and boys in programming is different, as I understand it, from engaging men and boys in advancing SRHR, either in terms of their personal lives or in terms of advocacy and activism. So the question is, are the methods to effectively engage men and boys in programming, do those apply to engaging men and boys in activism? I hope I have that question correctly. Yeah, is that clear enough? I'm just, okay. So why don't we take these 3 questions now first, Maria, and you respond to these, and then I will read out the other questions that are coming in.
Yeah.
So the first question is, what are the other SRHR areas? Second is about conceptual approaches and engaging men and boys in programming versus activism.
Okay. If you don't mind, you might have to give them one by one to me again, if that's all right. But I'll start with the first one that you mentioned. What are the other SRHR outcomes that we addressed?
Mm-hmm.
Well,
yes.
Can I say that we only addressed those 7 SRHR outcomes, but those 7 SRHR outcomes encapsulate a number of subdivisions within them. So in other words, even desired family size covers infertility, covers contraception, covers, lots of other kind of sub areas within that. And in the paper, we identified sort of evidence and gaps beneath those. And if it's okay, can I just refer you to the paper in relation to that question? But if you mean additional ones outside of those SRHR, could you come back to me now and ask me that?
No, that's fine. Leila says that's fine.
Is that okay? Yeah, it's sort of, that's the top line, and the deeper dive under that is available in the paper. Thank you.
Yeah. The second question, Maria, is about the conceptual approaches. For example, did studies look at hegemonic masculinities, and how did they conceptualize gender in their approach?
Yeah. Okay. So, so actually, in order for a study to be categorized as gender transformative, it had to explicitly engage in transforming unequal gender relations between men and women. And so in so doing, there was an explicit understanding of gender inequalities or power imbalances or so even though interventions didn't explicitly often use the term hegemonic masculinities, it was implicit in that. So I suppose crucially what we were looking for was, did it have something that is about changing unequal gender relations? Is there a kind of an explicit acknowledgement of that? So I would sort of say to you that in those 68 studies, while they may not have all explicitly spoken about hegemonic masculinities, it was implied. But Tim, is there a further question on that you'd like to come back to keep are we addressing the question you want?
I think, and thank you for this great conversation. I think I've seen quite a lot of interventions with men that call themselves gender transformative that don't actually conceptualize men's power. And I just think, especially in the context of SRHR, and more particularly if you think about contraception, I think there is a, I guess, is there a danger that we accept that unspoken kind of presumption that it's addressing power, but if it's not explicitly there, not only is that not good given power imbalances, but it could actually do harm. Yeah. And so, I guess I'm just maybe a friendly critique to say, do we need to better understand the conceptual approaches and indeed the way in which gender is conceptualized by some of these interventions?
Yeah. Okay. So I think it's a great question, and I think probably the answer is yes, and I'll let others come in on this as well. But I think that what we were trying to do was actually really identify those studies that acknowledged power imbalance, like not just engaging men and boys in contraception. Those would have been in the global, those were a part of the 462, but those that reached into the gender transformative pile were studies that acknowledged the need to address male-female imbalances of power.
Maybe just to add, I think, Tim, your point about, majority of the studies, let's say in the family planning space or HIV space, missing out on the power analysis is spot on, because the data basically show only 8% of the studies. So 92% of the overall studies do not explicitly address power relations, even though they say they're engaging men and boys. And in fact, the worst sort of offenders of not explicitly addressing power comes in the family planning space and in the HIV space. So the imbalance, the first paper that Maria shared, is that with a ratio of 16:1, for every one study that addressed power in the HIV space, 16 of them did not. And similarly, I think the ratio for family planning is, Maria, correct me if I'm wrong, 1:12. Yeah. One study that looked at contraceptive use by engaging men and boys in a gender transformative way, 12 of those did not. So, I think it sort of just speaks to the exact point that you're making, that this is why we say that the field of working with men and boys in a gender transformative way is in a very, it's still in its infancy. So I'll read the next question. Yeah. And I'm just encouraging all the participants to continue. We still can take a few more questions. We have the time. The next question we have from Jennifer Roast is saying that you mentioned the need for qualitative evaluation data. Do you have any thoughts on how we can utilize this qualitative evaluation data to greater effect? That is, in terms of its real and perceived rigor.
Yeah, I do. One thing to say is that the studies that are included in these reviews, okay, they're based on experimental designs, but as somebody pointed out at a recent meeting we were at too, to get to that stage, they have undergone likely a lot of qualitative evaluation in terms of, designing, refining, testing acceptability, testing feasibility, and then finally to experimental design. So one way of looking at qualitative research here is to trace back some of that qualitative research and add it back in. Okay, so that's one way, right? The second way is the way that I have suggested here on number 5. I mean, it is a suggestion, and everyone on this panel today will have opportunities to suggest what they think are fruitful ways forward in terms of future research directions. But I do think that since we didn't find any qualitative research specifically on 2 outcomes, this qualitative gender transformative evaluations for 2 outcomes using experimental designs, and that's loosely defined, okay, experimental design loosely defined, then I think that that's like a starting point. A clear starting point for me would be then, okay, what can we find for qualitative evaluations to address those 2 topics? And I think particularly, you know, in relation to SRHR and disease outbreaks, there has been a rapid escalation of research. Some of it will be on evaluation of interventions in SRHR in relation to COVID. So a rapid review of that research would be really fruitful to fill that gap. Mm-hmm. So those are 2 ways. But look, I do qualitative research all the time myself as well. So there isn't a kind of a non-qualitative bias here, but we were essentially looking for evaluation of interventions. And that is why we went for that particular design.
Okay. Maria, one question which thank you, Russ, for reminding me, is just your thoughts on exploring the distinction in the evidence between where interventions were just engaging men and boys in programming versus where there was an explicit attention to engaging men and boys in advocacy and activism.
Oh, yeah. I find this question challenging, to be honest. I don't know a great answer to it. I don't know if there is really a difference in the way that you address men and boys in interventions to get them involved in family planning and that for activism more broadly. But one thing that comes to mind, I guess, is that in targeting men for activism more broadly, that's where that outer loop of that COM-B model, you know, at societal level for challenging gender norms might be good. But could I instead, because I don't have a good answer to that question, could I instead ask you for an answer to that question? Share your thoughts on it, please, with us.
Thank you. Yes, good morning and good day to you all. I feel so privileged to be part of this conversation. I'm coming to you from a poor southern state in the United States. And I guess my thinking is, my experience, at least here, is that we have some effect in getting men to participate in the program, but have less effectiveness in engaging men, either in terms of changing their actual behaviors out of the programs, or more importantly in my mind, engaging men in the activism and organizing that we need to see men doing, particularly in this state, which is a relatively conservative state, in the activism and advocacy lane. And I'm curious as to, and so what has emerged for me is that there's a different program or process between getting, pardon my language, but getting men's butts in the chairs in terms of participating in a program, and getting men to actually engage in the activities that advance reproductive and sexual health and rights, that would move the agenda forward. Yeah. And I don't know what the research says around those distinctions.
Yeah. Yeah. Well, look, I'm going to just chip in for a minute, but I do think that if we're going to shift that 8% up, you're right on the button in terms of saying we have to build bridges to attract more people to work in this space in these ways. And that is about generating the rationale for this kind of work, creating bridges with work with men more generally, that 8% versus that 92%, to try and say, this is why we think you can work with men in these ways. This is how you can get men's bums on seats, and this is how you can do this work, and this is why it's worthwhile. And so I suppose in a way I'm only agreeing with you and let others in on this conversation.
Okay, I don't see any more questions in the chat box. I think afterwards Maria will post the links to the 2 papers that you mentioned again. But Maria, do you want to kickstart the panel part of the discussion with the question for Magali?
Yes, I do. I want to thank you all for those questions and enjoy the discussion, and especially enjoyed that all those questions. Now, forgive me, I had it up a second ago. Oh, but I remember it anyway, roughly speaking. It's Magali, can you tell me what you think are the main lessons for driving forward feminist-informed approaches to gender transformative work with men and boys? What are the key lessons? I hope that's right.
Yeah, it's about guiding principles for a gender transformative approach. Yes.
Thank you.
Do you want to unshare your screen?
Yes, I do.
Thanks.
Thank you, Maria.
Thank you.
For, great presentation, fantastic. I think, this time I had heard you presenting the data before, but I don't know, I think you've added more juice to it this time. It's so clear and so valuable. So thank you for that, and for sharing with us. And for the question, actually, it's a very good point, especially for us working with the Men Engaged Global Alliance around the world, and we have around 1,000 members or member organizations involved in this, and the SRHR is becoming an area of interest more and more. So it has been, but more recently, and we also are looking at gender transformative approaches in a more rigorous way. So I first, as you said, I would like to acknowledge that there are so many. So much work that has been done before. So I think, we got here stumbling upon the difficulties of working with gender equality and transformation, especially of gender norms. But also, when you put the two things together, SRHR, which is a very complex field, let's acknowledge that to begin with. So it's not only that talking about engaging men and boys and talking about changing patriarchal gender norms, it's a tall order, but it becomes even more complex when you want to address that in the context of health, which is a very power-driven area, and SRHR in and of itself very complex because it's at the core of the patriarchal system. So I think sometimes we minimize it. Oh, let's just involve men. And we know, like back in the 90s, there was a lot of talk, let's involve men in family planning. Let's have men engage, as if it was a simple thing, as if there weren't assumptions and barriers that we had to deal with. So the more I look at this, I think we need to, the first thing is to acknowledge the complexity. The other thing that I think it's important as we progress in this field is to look at the definitions. I think, you shared the definition you worked with of gender transformative approach, and there's also a definition that has been going around since, I think in 2015, there was a review of evidence done by Promundo IDS, the Institute of Development Studies, and Sonke, that put together a number of different evidence that dealt with the gender transformative approach in programming. And so the definitions vary, and that's also something that we need to address moving forward, so we are speaking the same language. Because, to say that gender transformative refers to projects that seek to transform, the tautology is there to begin with, transformative is seeking to transform. But to transform gender relations and to transform roles or transform norms, all that needs to be spelled out, because I think otherwise we risk being under assumptions that that are not clear to everybody in the same way. What are the norms? What's the difference between a norm and a role? When we talk about gender relations, and you clearly mentioned power relations, how do we further make that clear? What is it that we're trying to accomplish when we're talking about power relations? Is it power relations as it was in family planning back 20 years ago, having people talk? Is it about communications or inter-couple communication? So then you're dealing with the traditional patriarchal, heteronormative couple that's seeking to use contraception. So that's the old paradigm, as if communication was the solution. When we're talking about power relations, there's much more about autonomy, in decision making that needs to be there, or bodily integrity, and how we understand that. So I think what we need is to start accepting what we don't know, or what's not clear, and how we can work, especially with studies now like yours, to fill those gaps and start building the field in a more substantial way. Exploring and acknowledging the limitations of the definitions we have right now is one thing that I think would help us tremendously, and question the assumptions of such definitions. That some definitions, either they're not clear or they may be embedded in them. There may be some assumptions. For instance, that when you talk about gender relations, that you talk about men and women, and we are moving very rapidly into a different direction. Or that when we talk about gender, we're talking about gender relations or power dynamics, but are we addressing gender identities? Are we talking about gender assumptions, biologically or even non-biological? So I think we're entering a field where we're going to have to address a number of other issues. And if we want to do the tricky work of the transformation, I think the challenge that I see is that there's much more difficulties to be dealt with in the complexity of the SRHR world, and side of the equation, as I said, and then it is so much on the gender and masculinities side, and we sometimes tend to minimize. I think there are multiple agendas with different interests and goals in the SRHR field, and I think some of the people who asked a question before touched on that. So it's the SRHR field involves public health concerns, population concerns, development. So you have the heavy part of family planning and contraceptive use that drives the field. You have the prevention, and including HIV prevention and other STDs, that it's a very important part of SRHR. You have sex education, which completely, gets into a different realm. So it's like it's very complex. In some instances, you're going to have people concerned more with the contraceptive prevalence, and in other areas, you're going to have more interest in preventive behavior and risk-taking behavior. So all those things involve different power dynamics or different understanding of what is it that we're trying to address for transformation. So I think what we have been doing as Men Engage, is trying to look at the elements to engage men and boys in SRHR, assuming that we're talking about SRHR for all people. So we're trying to understand how the field has defined the benefits of involving men and boys, because that's one of the area. There is an assumption that automatically involving men and boys is beneficial, but there's very little clarity in why is it beneficial, how is it, is it beneficial to whom? Is it beneficial to the contraceptive prevalence, or is it beneficial to the prevention of risky behavior? Is it beneficial because it improves men's health in and of itself? So I think when we assume that that's a plus, we have to also articulate how it is a plus. The other part, as I will say about the expectations and the assumptions, be more clear in the future about how does change happen? So I think about the work of Christina Bicchieri when she talks about changing social norms, especially on other areas of SRHR, like harmful practices, for instance, and in how you go about addressing the stigma, the expectations that people have about their own communities. And all that, I think, needs to be more clear also in terms of engaging men and boys. What is it that we're trying to accomplish with the transformation of such norms? For example, the extent to which the change that we're seeking is change, it will also change stigma, discrimination that impacts people. And that could be in the HIV field, it could be on the abortion area, or even on the sex ed. Young people are very targeted, under those. So there's benefits in the area of health, that sometimes we take for granted, but sometimes they override also when we think about transformation. We want to see benefits in terms of the decrease of stigma, discrimination, exclusion. We want to have more increase in, as I was mentioning before, bodily autonomy and decision-making on the part of those whose bodies are directly affected by the intervention, or by the programming that it's at stake, be it contraception or be it something else. So, I think we, as the field evolves, what we're trying to do is to go take some steps back and have these conversations among, people interested in engaging men and boys in SRHR, to clarify our own assumptions and make sure that we are all, speaking the same language when we're putting an intervention, forward, be it at research or, as Russ was saying, advocacy or communications, or it could be any type of programming. The assumptions need to be questioned and clear, and that we all understand the same thing by the terms and definitions that we're using. And I like to also think, Gita Sen said that the goal in the future is to have a more inclusive approach to the right to health. And I think that applies to our field as well. Because if we're going to continue to look at health and health for all, and SRHR within that, as embedding the right to health, what does that mean? It means access, but is it also, again, you have the discrimination, the exclusion, a number of other issues, stigma, bodily integrity, and so on and so forth. So and Gita also said, a forward-looking agenda would focus on quality, equality, and accountability. And we need to define those two. As you all know, quality has been discussed since the 90s. The Population Council had huge work on quality of care. And we're still discussing quality of research, but also quality of programming. And what is it that we mean? Because again, the powers that drive the discussion is quality what results in a better contraceptive prevalence, or in better prevention of risky behaviors? Is that what we're still dealing with? Or are we talking about a different level of quality? So there are some assumptions that we need to visit. Equality too, It's, as you know, the field was impacted in the beginning by assumptions of gender equality, that if you have men, now you have men and women, therefore everything is equal. And and that's what we mean by gender equality. So that simplicity is no longer in anybody's interest, and we want to define equality in terms of how men and women can have full autonomy and decision making over their sexuality and health. And obviously the accountability, which for us at Men Engage is very, very serious, and it's an experiment in process that we are that we are working with. So I don't want to take more than my time. I think I might have already passed that, and I would have a number of ideas for us to continue discussing. But I would like to invite Shari, who has done an incredible amount of work in research, to talk, especially how we can evaluate with new measures to define what we're trying to do, the innovation of our work, and how to, and I know that Shari has already done work, in touching on intersectionality or the assumptions of heteronormativity. There are a few, has done before. So Shari, I'll pass it on to you right now, and then we'll continue the conversation.
Thank you so much, Magali. That is a very complicated question to answer at 6 a.m. So let's do it. Thank you so much for the opportunity to be here. Maria, so wonderful to see the new study, the second study. I had seen the first, really wonderful work. And Magali, what an amazing amount of cumulative work you've done on the ground. I think I'll focus on 3 or 4 points, and I think my points will kind of bring together some of the comments on the science base that Maria's made and some of the advocacy and community level work that Magali's made. So the first thing I'm really seeing out of the review of the evidence is just the very basic observation that we clearly need more randomized trials in the field and more rigorous evidence. And of course, more randomized trials are great, but we also know that we need to say more than just that we need more randomized trials, because there is a lot of community-based knowledge on the ground that's been collected cumulatively over decades that is relatively untapped or taken up in the science space. And that's really a call for academic institutions and community-based institutions to work together to be able to put more rigorous theories of change onto the models and to think about the measures that would be integrated given your perception of mechanisms of change at work, and to really bring the scientific and community-based worlds together more. And obviously there are many examples of that, but to do that more frequently and more robustly. I want to make one other side point on this comment, which is I don't want us to only walk away from this and say, oh my gosh, only 8% of programs are gender transformative. Look how much the field has failed in being explicitly gender transformative. There are also some really intriguing nuances to why that data point is there. And in the science space, it's so interesting to see the intersection of the politics of funding with the degree to which investigators are explicitly gender transformative. So what I have seen is, even if it's the case that at their inception, projects are very explicitly gender transformative, rife with content on gendered power, thinking really critically on gender inequalities and women's status, focusing on critical reflections on the costs of masculinities to men and their partners, they can later become stripped of much of this content in the process of the politics of funding due to reviewers or due to less radical content being accepted in streams of funding, or the content gets stripped because the grants end up having to shorten the actual number of sessions in the project itself to have it fit the broader design of an RCT to the extent that they can get stripped of their full transformational approach. So there are some challenges that I have seen in terms of the intentionality of programs to be gender transformative and how that can shift as grants move through the process of the politics of funding. The second point I will say I'm drawing from Maria's multiple systematic reviews and her team, of course, is that it seems like even though there are a greater proportion of community level interventions than some of the other categories, that category of community mobilization and community level transformation is still sorely lacking. And there was a new review that just came out, which identifies community level mobilization as one of the key promising elements in gender transformative interventions, along with intervening with women and men together, as Maria's pointed out. So this idea of just needing more community level interventions is really critical to highlight, because obviously our small group interventions are costly and reach fewer people. And also we can take broader definitions of gendered power and gender equality and end up translating it into measures that are more so at the individual level. Mm-hmm. So translating kind of broader structural and community transformation into ideas that affect individuals. And I'll get to that in a second when I delve a little more deeply into that when I think about measures with you. So missing kind of methodologically and in measures is this sense that gender transformation and masculinities in particular are structural. So again, structural intentions may be embedded into gender transformative interventions at the outset, but then when you delve more deeply and look at the measures themselves, you can see these are translated into measures of individual agency or small group gender norms. And it's interesting, right? I'm a social scientist trained in public health and medical sociology, and there really is this robust social science literature on masculinities as structural and masculinities as collective action and masculinities as collective practice, which would be consistent with more of this concept of needing community level interventions. And it's super interesting to me to kind of ask the question of why is it that we're so largely focused in the gender transformative field on norm change for men, but we recognize the need for structural interventions for women so profoundly. And so I just want to ask the question, like, might it be the case that the next stages of gender transformative work with men include more of this community and structural based intervention? The caveat to that, of course, is that how is it that you empower men structurally and not reinvigorate men's power over women when you're arguing in the field that men's power over women is in part of the driver for poor health outcomes? So that's a really interesting question to think through and very, very important. And then the third point, kind of taking some of these ideas and moving to specific measures, it's so critical if we want to improve work with men in the sexual and reproductive health field, and we want to think critically about measures, that we have to be so careful and intentional, as Magali has pointed out, about how you define the mechanism of change in gender transformative work. And when I think about this, I think about the question of what you consider the mechanisms of action to be around gendered content in particular. So focusing then more deeply on that, if you look at some of the validated measures in the field, we see the gender equitable man scale, which is designed off of the concept that we need to work to change harmful norms and reduce inequitable norms and attitudes towards women. And so this clearly measures how individual men change. And as I've pointed out, that takes a community and structural level idea about social change and translates it to individual agency. I would argue that not enough studies use the validated measure that exists. We have a validated measure, the gender equitable man scale. Some studies use it. More studies should use these validated measures if we are arguing that the mechanism of change is reducing inequitable attitudes and norms towards women. There's also the sexual relationship power scale, both of these designed and implemented by Julie Pulowitz and team. The concept of looking at relationship power as a validated measure in gender transformative interventions doesn't happen all that often. Not just because we don't include women and men in the same intervention, but also because we're thinking a lot of the time about how men change within the interventions, but we really need to understand not just women's health outcomes in these interventions, but whether we're measuring women's status, women's empowerment, the democratization of gender relations in these interventions. So it's going to be really critical to have validated measures of relationship power, of women's empowerment, of women's status embedded into the interventions as well. And there's a huge field on this, right? In the women's empowerment and sexual and reproductive health world and beyond, and other health outcomes. There's a huge repository of measures in the women's empowerment realm that can be added to this work to really see, are we improving a woman's health outcome when we work with men, but not democratizing gender relations between women and men? So it's really critical to include these measures as well. I would argue, too, that we really need to create outcome-specific new measures. For example, I just designed a gender transformative intervention focused on family planning and family size with men in Kenya, with colleagues at UCSF in San Francisco in the US. And we just had a paper accepted that's really the first rigorously developed and psychometrically evaluated tool to help to measure men's contraceptive acceptance as a function of gender norms. And we wrapped the intervention content around this area to guide men to work with their partners, to reduce inequalities, and to be vastly more consultative with their female partners to achieve reproductive preferences. And it's called the Masculine Norms and Family Planning Acceptance Scale. And this matters for a few reasons. As Maria's already pointed out, there are very few measures in this arena, few interventions in the family planning arena. And this is despite the case that the field has really overwhelmingly made the claim that it's male resistance that's one of the primary areas that need intervention, and yet there are very few gender transformative interventions in this area. And I can talk more about why that's important and what qualitative work we did to guide that measure creation, and what are some of the elements of that in the discussion. But I'll stop there. I think that the 3 points on measures then: use the validated measures that exist, add in women's empowerment measures that are focused not just on the health outcomes of interest, but on the process of democratizing gender relations between women and men, and focused on, empowering women, and focused on reducing inequality between women and men. And third, consider creating new measures that are more proximate to the health outcome of interest and not solely using the gender equitable man scale, which is set up to be used with all health outcomes that we're intervening on. And with that, I think, other than opening it up to questions, Avni, I have a question for you, but I'll pause here and see if there are questions. You're on mute. You're on mute, Avni.
Yeah, no, I was just saying maybe I can go next and just maybe share some reflections on what we think should be the way forward. And then we open it up. And I'm just going to ask everybody to continue to post their questions in the chat box. I think Magali is keeping a track of what people are asking in the chat box, and then she will direct it to the appropriate panelists.
Yes, there's a question, there's a comment from Tim that in his research, he found quantitative surveys using the gender equality and men scale, the GEM scale, to be poor measure of gender norms. And while qualitative provided clear picture of male hegemony, we should not rely solely on quantitative measures, in his view, to make assumptions about what men think or how they behave, referring to gender equality. So I don't know if it was just a comment. If you want to comment back, Shari.
Absolutely, yeah. I mean, I couldn't agree more. I do both qualitative and quantitative work simultaneously, and I think that there's a beautiful interplay actually between the two that gets more depth of information and gets at contextual modifications of various ideas, and also advances the rigor of the field. So I really agree that we need more of that. I mean, two comments. When we deployed ideas from GEM, we really vastly modified it to be closer to our specific health outcome of interest. So we did 5 years of qualitative work to really understand what men thought about the issues. We found that it's not just content on reducing inequalities that we needed to cover, but we also needed to think about how men related to content on the costs of masculinities to men and their partners. There have been some reviews in some countries which show that those two elements of work together are more powerful together than one or the other. So simultaneous focus on gender inequality related work and work that focuses on the costs of masculinities to men, as men can deeply relate to that material which is reflecting on their lives and the harms to their themselves and to others. And that can be a nice segue into then material on gender-related inequalities. One of the reviews that looked at a lot of the content on gender in particular within programs has found actually 3 strands. So in addition to work on the cost of masculinities to men and their partners, and the work on reducing gender inequalities, a third conceptual arm of the work seems to be on multiple masculinities. And this points to what the question is really honing in on. And this is the content on kind of critiques of hegemonic masculinities and ideas about whether men in situations of poverty reify or contest ideas about hegemonic masculinity, and focusing on the benefits of alternative masculinities to men and their partners. And what I've seen in some of those reviews is that men are most inclined to embrace the material on costs of masculinity. They find it challenging to contest hegemonic masculinities, because if they're disempowered and marginalized, masculinity is a resource and the source of identity and power. And also, they were the most contested about the material on reducing inequalities between women and men and on democratizing gender relations. And we've seen that in other works, that can be the most challenging realm. And all of us have ideas that we can talk about for how to improve on those challenges. But it's a really, really good question, and I appreciate it very much.
Maybe I can just share some reflections because this has been quite a rich discussion. I can share a little bit of some of the reflections from an expert group meeting we had at this point, seems like ages ago, but a year ago, on what really came out of what we think the group thought about a priority research agenda. Because, how do we take what we've learned from the evidence review, from that, more than a decade of work that's being done on the ground in communities on gender transformative interventions, and come up with a priority research agenda that we want, at least in this, what I call the next generation of evidence gathering on men and boys and in working in gender transformative ways, that we build on these lessons learned. So in December of 2019, we convened a small expert group to reflect on all of the evidence and ground level experience, and basically came out with some consensus ideas on what should be, just domains, topics, themes, etc. And this will feed into a research priority setting exercise that we will, WHO and HRP will undertake in 2021 now. And we will use what is called the research priority setting methods that WHO approves for such exercises, such as CHINRI, such as Delphi, a combination of things. And the objective of this exercise will really be to identify the universe of domains, topics, themes that we need, that we think the group, wide range of stakeholders think are priority for evidence gathering going forward, and to prioritize the ones that the group will think are most pressing and most urgent. And the way we are going to undertake this is, first, we will actually get a fairly comprehensive list and crowdsource stakeholders that I think can input into this process. And there are very interesting and innovative ways people are doing this currently in the context of COVID. And then really be able to come to them with a list of questions, themes, etc., and garner and really gather more ideas from the group. And then the second round will be arriving at a consensus of what is priority, what should be prioritized going forward. So this is just a little bit of the reflections on the start of this process that happened. And what was interesting is, echoing some of what Magali and Shari and Maria have said, I think what came through quite clearly in that expert group meeting was really that, we really need more transparency in how interventions are being documented and reported. What is the theory of change? What is working? Why? What change are we trying to see? Is it just individual attitudes, individual behaviors, or are we trying to go beyond that? Secondly, is it just men's health outcomes, women's health outcomes, or are we really striving to change bring about social change, population level change in relation to power relations? And none of these are mutually. I think the other theme that came through quite strongly in that meeting was recognizing that there is, this idea of hegemonic masculinities is not homogeneous. That, if you take into account in the feminist world the notion of intersectionality, that the same applies, that men's masculinities may differ based on their age, based on sexual orientation, based on race, ethnicity, etc., and that we really need to be more mindful in actually building that into the research going forward, and how we design studies to take into account the different masculinities and norms of these subgroups of men. I think the very striking thing that came across from Maria, and I think Shari also alluded to it, is we know much more about individual change and group level change, which we call the small s, but the big structural changes in masculinities, in patriarchal institutions, is really missing. That has been the area where there has been least development in terms of creative programming, creative ways to foster change, creative ways to capture whether change is happening, and evaluate, what is working and what is not. So I think that is really what I would say the next generation of programming and evidence building that needs to happen is structures that are patriarchal, changing those structures that promote masculinities. I think there was a real recognition that change is not linear, that change is, and we saw that there's just been in the last year itself a huge backlash and a backsliding to gender equality in so many ways due to COVID. So it reminds us that anything that we capture temporally has to account for the fact that there will be secular changes, there will be non-linear changes, there will be backlash and backsliding. So how do we measure outcomes that capture this time and temporality? I think the other thing that came across specifically across all of the topics, whether it was STIs or family planning or maternal health, was the fact that we don't know if any of these interventions that have been evaluated, the 39 reviews and the 65 or how many ever studies that Maria presented, are these results basically replicable in other settings? Are the results transferable? Are they scalable? And are they, as you say, externally valid? We actually don't know that. And we know very little about taking masculinity interventions to scale. Whether we can actually take, what we've learned from whichever interventions you can give examples of, can they be built into large-scale platforms and be in a sustainable way? We don't know that. I think the other thing that the group sort of really identified as issues that we need to go forward in thinking of a research agenda is other than randomized controlled trials, and I think Shari and others alluded to it, is how do we still continue to gather high quality, robust evidence with other methods, including qualitative methods. And in the STIs and HIV area, which is in the SRHR outcome area that Maria Lohan pointed to is under sexual health, I think people identified really the need to build a more critical mass of community and multi-level interventions and to really see what aspects of masculinities change when you intervene at that, what we call mesostructural level, so large-scale communities, and how obviously would those lead to improvements in HIV interventions. Then there were very specific areas like how do we really target interventions to improve men's health-seeking behavior, how do those gender norms change to affect men's HIV testing, treatment, and care cascade. How do we capitalize on key influencers of men and masculinities when it comes to sexuality, sexual behaviors? If you're working with adolescent boys, how do we work with parents and caregivers to build more egalitarian masculinities? How do we work with religious leaders? How do we work with traditional healers, etc.? There were also questions around the whole notion of alcohol and masculinities in the HIV world. I think that was a very pressing concern. An important thing that I think all of the group identified was that, we talk about positive outcomes and tracking positive outcomes, but we need to be more mindful about tracking unintended, both unintended negative and harmful outcomes as well as unintended and positive outcomes. Because if you apply the principle of do no harm, then you have to be explicit about tracking the unintended consequences of male engagement, both for men as well as for women. Then there was a whole set of issues that were identified around the fact that health systems that are providing sexual and reproductive health services are themselves gendered, that they are patriarchal, and the ideal entry points for men to access sexual and reproductive health services or for men to be reached at can actually reinforce patriarchy or can be transformed, but we are not doing enough with those health systems to actually promote more egalitarian ways in which to work with men and to reach out to men. So that itself needs to be questioned and challenged, and that is a big intervention development agenda. In the area of maternal health and pregnancy outcomes, the group identified the fact that we need to have interventions to design to help men be better partners to pregnant women, but the balance, and that was a very important point of discussion, both for maternal health as well as for abortion, is we don't want men to take over and make decisions for women in that space. So where is that very fine line between getting men to engage as supportive partners, but without, impinging on women's rights and women's autonomy in controlling their own bodies? So that was a big thing. And how do we then also design interventions that empower men to be around fatherhood and, sort of addressing engagement of men in taking care of newborns and infants and, playing that fatherhood role? And how do we obviously support, how do sexual and reproductive health and maternal health services support that? I think there was a big discussion around in the family planning space that we really need to focus on what men's concerns and resistances to family planning use. What is the driver of that resistance to family planning use, and to go beyond the notion of this idea that, contraceptive decision making has to be more collaborative and intimate process. Sometimes it is, and sometimes it isn't. And sometimes it's important to let women make those choices and decisions over their own bodies. So again, really unpacking those things. Also, how do we how do we design interventions that are more pleasure positive and not just around this notion of disease or pregnancy prevention, but really, because that is one of the big ideas around which, for men, it is one of the big concerns that it may impinge on pleasure. So how do we build more pleasure positive interventions working with men? And then in the area of adolescent health and boys, working with boys, I think that there was a lot of discussion around using ACE scores to focus on the most marginalized boys, the need for longitudinal studies that track, and unpack what is happening with boys over time, how then their attitudes and norms shift over time. And then really the other issue that came up, which is less at this point known and understood, is the increasing role of media, social media, technology, and online space in reinforcing, hegemonic masculinities or however you call it. And how do we actually address this, in ways that are more sort of building positive notions around masculinities? I think the other topic that came around in the area of safe abortion was the fact that we need to balance the fact that, women's access to abortion and restrictions are already a result of over excessive male involvement. Men want to control women's access to abortion. They want to legislate it. They want to deny women access to abortion, whether it's putting in third-party consent rules or requiring the partner to consent before you give them access to abortion. So is that the space where actually you don't want or you want to kind of scale back on male engagement simply because it's actually a space where male engagement has been harmful in denying women access to safe abortion? So that was a big, I think, point that I thought was quite interesting. And also, as the world moves away from facility-based access to abortion, but more to self-abortion in terms of accessing pills and things like that at home, what is then the role of men as partners in that space? And I think the last bit in the area of masculinities and infertility, which is, as Maria pointed out, an area where there was very little knowledge. Some of the priorities identified by the expert group were, how do we actually unpack the role of masculinities in the stigma that is targeted to women and men with respect to infertility? How do we, how do men view the issues of impotence and infertility? How do men understand the issue of male infertility? And how do they understand and look at the issues of drugs that are available and the technologies that are available to overcome infertility. So we had, I think, Magali and Shari and Maria, all three of you were there, but I sort of feel like it's looking down at what was there a year ago. But when I re-looked at all of the conversations, I felt like we had a fairly big, robust set of very interesting discussions around what should be in the SRHR space, the priorities for going forward. I'll stop here. We are a little bit over time. I don't know if people mind staying on for a few more minutes if they want to still have a conversation, or if people want to maybe just post their questions and comments and we take it offline. What do you think, Magali?
Oh, we're not really over time because we had 2 hours. So I think.
Okay. Sorry, for some reason. Oh, okay. I had in my mind 90 minutes. I don't know why. Brilliant. Okay, this is brilliant. It's great to know that we're not running out of time.
Yeah. No, I think you summarized very well, the complex discussion we had a year ago in Geneva. And so the thing is that how do we go about making it viable for this complex list, this agenda, to be launched, and how to deal with all the different nuances. No, the areas that are more sensitive or that are less evolved, so to speak. And I particularly think, what you touched on the structural level, healthcare facilities, healthcare systems, and how patriarchal they are and the way they are organized is a huge area, because we have been for 30-something years now trying to address the individual, and that is only possible, to a certain extent, because once the individual is, in an ecological model back into a system, the natural tendency is to survive. You respond to that system, and then you forget all the changes you had incorporated in your own behavior, and you go there. So I think, we need to look at that. And I know that agencies like UNFPA is looking very seriously at that. We're open to collaborate with them as well in trying to see how we can look at the healthcare delivery systems, but it also, in information systems and in other ways, how we make that more porous, at least, to the gender equality agenda. I'll just leave it at that.
So it's open. I'm seeing people posting in the chat box. I'm so glad that we have more time, Magali, because I was a little worried about running out of time.
Yeah, there are more. Yeah, there's just a comment from Margaret. Meg Green has to leave. She was also with us, so it's too bad that she has to leave, and that Tim is also having to jump off. So I think, we maybe have more time, but some people may not. But I don't know if Maria, since you were the first one to speak, if you have any comments now that we all spoke.
Thank you. It was a great discussion. I would really love to maybe push to Avani's idea of trying to find out what people think are their priorities for future research on foot. I think it would be, in any way you think feasible, either chat or your poll or whatever is simplest, but there's a lot of good people here on the line, and it would be lovely to hear from them what they think are the priorities for.
I don't see things coming in the chat box, but maybe we could run the poll, Magali, and get people more engaged. It will give people a chance to perhaps in a different way engage in this.
Yep.
Okay.
Yeah, I agree.
Okay, great.
You have the powers of a co-host. You can.
Okay, I'm doing it. I'm sorry. I'm just restart. My computer chose to freeze at this particular moment.
Yeah, they have that capacity to do that when we least need that.
Okay. So can people see the Slido link?
Mm-hmm. Yes, it's on the screen. Yeah.
Can you see it? So what I'm going to ask next is for all of you who have access to a mobile phone or a tablet or a laptop to go to slido.com, and then there's says event code, and you have two options. If you have a phone, you can scan the little QR barcode that's on the right hand side. Or if you see the thing that says event code, you type in this hashtag 86405. Okay, so I'm going to start the first poll, and I'll give you a little bit of time because it's quite a number of options. But what would be great to hear from this group, and you just have to click. Basically, I've given you a list of 15 topics which came out of this expert group meeting that I'm going to ask you to rank your top 3 priorities that you think are important for creating a research agenda going forward. So that's the first question. And then the second question will be to submit your own topics and ideas, whether they are in the form of a question, whether it's in the form of a topic, whether it's in the form of a statement that you think should be added to the list that we have already compiled, okay? So I'm going to start the poll. And the question, as you can see on the screen, I hope everybody can still see the screen. Yeah? So the question is, what are the top 3 priority topics or questions to research going forward on engaging men and addressing masculinities in the context of SRHR? You can select up to 3 options. So I'm going to give you a bit of time as we go through it. Scroll down. There are a total of 15 options. Out of these 15, I'm forcing you to actually prioritize 3. So go ahead and select or click whatever is your top 3, and I'll give you about 4 minutes.
I think you have your top 3 there.
Okay. I have 9 people who have responded. I'm just waiting because some people take a little bit longer to read through all 15 options and then come up with a decision of top 3.
Yeah, no, I agree. I find fascinating. I didn't know Slido, so it's really.
I'll wait just another minute to let everybody get a chance to take their time and weigh in. Okay, so the top 3 so far is the top number 1, which got 50%, is how do we disrupt patriarchy in institutions such as health, legal, government, media, sports, business, workplaces, etc. The second, which has 42% of the vote and is tied together with the third, which is how do we develop gender transformative approaches to working with men? How do we address masculinities among men across age, religion, class, race, ethnicity, and sexual orientation, which is basically getting at that issue of intersectionality. And then the third one, the third one, which got 25, or several of them got 25% of the votes, but maybe just I'll read out one, which is how do we address the structural determinants of hypermasculinities, such as nationalism, militarism, racism, globalization, and political upheaval. So really the large scale, trends that we are seeing in the world today. So that got 25% of the vote. Okay. I'm going to go to the second poll. And the second one is asking all of you to submit your, list up to 3 topics or questions that you think that were not in the previous list. If you thought that, the 15 that we gave you was not comprehensive enough and that you have identified are important to you, please list or identify up to 3 topics that you think should be prioritized for research in order to enhance evidence on and approaches to working with men in the context of SRH. So now you should be able to type your priorities in, and you can identify up to 3. Is everybody, should I read these out?
Oh. Yeah, I think you should, because we have only 3 more minutes.
Oh, ooh.
7 more minutes, I'm saying.
Okay, sorry. What did I do? I did something wrong.
No, I think you still have it there.
Yeah, no, I'm just trying to show the session. Deactivate the poll, no, share. Nope. How do I did something wrong. Wrong button, oh dear. I clicked the wrong button. Hide results. I want to show the results. View results. Okay, so in this, can you see, let me make this as big as I can. In terms of the topics that people provided inputs, I'm just going to read them in order. The first one that I see on my screen, it says preventing unsafe abortion. What is the available qualitative and mixed methods evaluation research on gender transformative interventions with men to support SRHR in our disease outbreaks, and how to develop and sustain, evaluate male engagement, gender transformative programs and case studies. Okay, I'm not sure if this is a list of things that are published or it's a topic. The second one is engaging men and boys intergenerationally along the developmental stages, that is ways in which we can engage pre-adolescent boys, adolescent boys, young men and older men in a structured way, and structured and integrated way, which I think that's a very, very interesting idea. How can work by men and boys for gender equality remain accountable to feminist and women's rights organizations while maintaining autonomy? The next one that somebody has suggested is how do we develop common denominators in gender transformative approaches that may be used across the field, even when addressing other factors? Or is there a gold standard in gender transformative approaches to research? Evidence of where comprehensive sexuality education has helped adolescent boys and young men change their perception, attitudes, and behaviors vis-a-vis gender norms. How does policies, national, global, shape masculinities with regard to SRHR? Do we know of any countries that are seeking to have a positive effect in this area? And then one person who said the list was comprehensive, but they suggested prioritizing community level interventions that test a gender transformative intervention arm with a women's empowerment arm, and combining women's empowerment and gender transformative into the same. That is a combination approach. Another person said, what are the external factors that are influencing masculinities? How do we address sexual and reproductive health and rights of men and boys in the context of women's sexual and reproductive health and rights, and in ways that advance social justice, gender justice, and equality? What is the influence of culture in men's education? And where do gender synchronized approaches in relation to SRHR, where have they worked? So this is a very nice additional list of topics and domains that we have received from all of you. Quick one question. If you have any suggestions on groups, stakeholders, and people that we can include in our outreach for developing and building this research agenda, I'm going to post my email in the chat box. Please feel free to reach out and send me your names of people, individuals, institutions, and organizations or networks that you think we should make sure are included when we kind of take this to a broad range of stakeholders. So my email in the chat box is, please feel free to email me with your suggestions of who we can include in this process. Our aim is really to be inclusive and reach a very wide range of stakeholders to consult in setting this research agenda. I'll stop here and over to you, Magali.
I don't think we see your email in the chat box. You might have sent it to a just to one person, not to the whole group?
Oh, sorry. Yes.
It happens to me all the time. That's why I'm saying.
Yeah, no, you're right.
I don't know who you sent it to, but there we go.
I'm sorry.
Yeah.
I did that clearly.
This was fantastic, and I think we unfortunately ran out of time, so we're going to have to wrap up. But I'm really, pleased with the discussion. I hope you all enjoyed. Thank you, Avni, for proposing and leading this session, and thank you, Shari and Maria, for incredible contributions, and to all of you who participated in our symposium today. So
thank you, everyone.
Yeah. So that's it for today, I guess.
Bye-bye, everyone.
Bye.